In medicine, you will never stop learning.
Okay.
It's a lifelong learning development, if you would. Every
Okay.
year, physicians have to take so many hours of what they call continuing medical education, or CME.
Okay.
You have to enjoy working with children. Otherwise, it's going to be miserable for yourself, for the patient, for the parents, and it's not going to be a good experience. You have to like children. And then also you have to be a people's person. The parents will come in at their most vulnerable time.
Joining me today is Rosina Avila Connelly, and she is a pediatrician at Baylor College of Medicine. So Rosina, welcome. Thank you for joining me today.
Thank you. Thank you so much for inviting me.
Of course. So let's go ahead and get started. Rosina, in the most simple way possible, can you please explain to me what a pediatrician does?
This is not a short answer,
Okay.
but a pediatrician in general is a physician who takes care of children from birth through 18 years old, sometimes 21 years old. You know, I think it's important to differentiate that as a pediatrician, you are not just taking care of the child. As a pediatrician, you have a relationship with the parents, sometimes
Okay.
since before the birth of the child. And
Okay.
it is important to realize that this relationship will last until the child is teenager, 18 years old.
Yeah.
And then it's not just taking care of the child, but also many times taking care of the environment at home, the parents, and what it is called the triad of this pediatrician relationship between the parent, the pediatrician, and the child. And that's what
Perfect.
differentiates pediatrics from general medicine or adult medicine.
Okay, that's great. And so now, what made you want to get into this career path? How did you get your start in it?
To start, one has to know whether you want to be a physician. And being a physician is not an easy profession. You have to have a calling. It's about serving others, about putting the patient's needs before your own, because it involves sacrifices and it involves long hours of studying. And once you become a physician, then that's when you decide whether you are going to subspecialize in pediatrics or continue as internal medicine or general medicine for primary care type of physician. And this is usually known towards the last 2 years of medical school, when you are rotating through different subspecialties, including pediatrics, OBGYN, surgery, pediatrics, and so forth. And by the time I was going through my rotation in pediatrics in medical school, then I knew that that's where I wanted to be, and that's where I wanted to go in terms of my subspecialty and my residency training.
That's amazing. So now, what parts of your job are the most exciting or the most interesting to you?
The most exciting part of my work is to see the child grow, sometimes since birth or even before birth, as I mentioned before. And then you have this child who comes in, and then little by little, you see how the child grows and develops, and again, this establishing the relationship with the parents and helping them, if you would, to go along this path of being parents. But definitely, it is so great to when the child is already of 3 years old, 4 years old, and so forth, when they can carry on a conversation. And children have the most incredible things to say, and how they interpret the world, and what makes them happy, what makes them feel afraid or scared, and then that opportunity to have that relationship with the child, when he can talk in different ages and stages, it is really rewarding.
Yeah. And so now, on the flip side, what parts of the job are harder, emotionally challenging, or not so fun?
Definitely, it would be giving bad news. And a
Okay.
lot of people would think you're giving bad news in terms of you got cancer or your child has a genetic condition. Definitely, those are serious bad news that one has to deliver. But so many other things that are more common. Your baby has an ear infection, and a lot of parents take that as something really serious. My baby has never had an ear infection. And so it's how you deliver what even the most simplest of the diagnoses, then it is important to deliver it in a way that the parents are not going to be shocked. But yes, definitely the most difficult part is when it is really something serious, and it is very emotionally difficult to explain to parents and to also go through as a pediatrician.
Yeah. And so now, what are some things that you think people might underestimate or overestimate about this job? Another way that I like to ask it is, what do you think that people assume about pediatricians?
It's interesting. I've never asked myself that question. Although, okay, this is going to be very silly, but in looking at Instagrams, and then you know how they have someone who portrays different specialties in medicine, and then the pediatrician is always portrayed as someone who's fun, that dresses up, that does silly things and says silly things, and I feel that that's very important in terms of carry on your work. I like humor, and I like also taking things not so seriously until, of course, you need to take things seriously. But yes, the pediatrics is amazing because you do get to dress up and you do get to wear, funny looking or playful type of skins, and kids love that. And it's an opportunity to start conversations. I had my badge holder has a cat, and then since little kids are, and then older kids are, is that your cat? So it is that's a characteristic of pediatricians that sets them apart from the rest of the specialties in medicine, I believe.
And so are there, within pediatrics, are there other niches or specialties that you can choose to go into, or is pediatrics just one specialty?
It's absolutely, there are several subspecialties that one could choose to become after finishing your residency training in pediatrics. You can be a cardiologist, you can be a neurologist, you can be a gastroenterologist, endocrinologist, anything pediatrics. And there is a huge need for pediatric subspecialties. So as a general pediatrician, I joke about the fact that in primary care, you have to know a little bit of everything. From the tip of the hair and dermatology all the way to the toes and everything in between. And then kind of like start the work before the patient gets to see the subspecialist. But yes, there's definitely options other than just general pediatrics.
Okay. And so now, before we got on this call, I had to do a little bit of research about the average salary of a pediatrician. And from my research, it is around the $200,000 range per year. From your experience, do you think this is accurate? What do you think about that number?
It is a good starting number. Earlier you asked what differentiates pediatricians from the rest of the specialties, and I was going to joke about that because definitely pediatricians are not the highest paid physicians. Everybody's like, "Oh, you're a physician." Yes, but I'm a pediatrician. And so 200,000 is an okay, or definitely a median, right, across the United States. But that is definitely for someone who's, depending on how many years out of residency training, then you get a different starting salary. Many clinics will offer what they call bonuses, productivity bonuses, and then in addition to the base salary, then you're going to receive extra money that will sort of round up your annual income. But out of residency, that's not the number. And I feel that's important for anyone going into pediatrics to realize.
Yeah. And do you know why, or maybe have an idea as to why the pay for pediatricians isn't as much as other physicians, maybe?
That is a very interesting question, and I do not think I have researched
Okay.
that.
Yeah.
The only thing I can imagine is that not only pediatrics but anything primary care
Okay.
it's not given that much value.
Okay.
I think the system rewards subspecialty care because
Okay.
the higher the training and the most subspecialized that one doctor is, then of course the level of care, the level
Mhm.
of services will have a higher rate of
Okay.
reimbursement.
Yeah. And so now, what are some trends or challenges that you see as a pediatrician, and how do you kind of see the role or the job changing in maybe 5 to 10 years?
It depends on generations, right? It's a
Okay.
generational type of answer. I feel different generations have a different view of what your work should look like. And a lot
Okay.
of newer generations are looking more into flexibility of scheduling, your work flexibility, if you would,
Okay.
and also that balance between life and work. In pediatrics, in my experience with general pediatrics and primary care, it is how many patients you can see in a day.
Okay.
In a system that rewards volume over quality. And this is
Okay.
not just for pediatrics, but in general across medical specialties also. I believe that's affecting how the job as a physician or a pediatrician in this case um, uh, will evolve in the next 5 to 10 years.
Okay.
In many job opportunities will require you to work 5 days a week, sometimes weekends. Also,
Mhm.
you will have to take call, answering phones for patients, for moms with questions after hours. And it needs a lot of work that is involved
Okay.
other than just seeing the patient and
Yeah.
making a diagnosis and giving recommendations or medical treatment. There's so much that goes behind the scenes in medicine across medical specialties, and physicians have to usually take at least 2 hours after clinic is done to complete documentation in the medical
Okay.
record. And that definitely adds on to the workload. And there's
Okay.
only so much that one person will be able to go on, depending on just feeling also not so, that one doesn't have a lot of autonomy if you are
Okay.
working for a big employer.
What about artificial intelligence? How has that, or has it been affecting your work?
From the patient's standpoint, a lot of times parents will come in and say, well, I look up in
Mm.
Google. And of course, that sometimes search engines will give,
Okay.
especially nowadays, will give out an answer from an artificial
Yeah.
intelligence type of answer. Um, in terms of medical decision making and programs kind of indicating your how the algorithms in terms of these are the symptoms, these are these are the possibilities for diagnosis, this is my differential diagnosis, this is the treatment options available. I feel
Mhm.
that's coming. I feel that
Okay.
there are developments for incorporating AI into medicine. I have not seen it in pediatrics to date,
Okay.
in
Okay.
my experience.
Okay. And so now, as a pediatrician, and even as just a doctor in general, you kind of have to keep updated with new findings and the science. So, how do you see that you kind of stay up to date with the latest developments of pediatrics?
Excellent question, because in medicine, you will never stop learning.
Okay.
It's a lifelong learning um, development, if you would. Every
Okay.
year, physicians have to take so many hours of what they call continuing medical education, or CME,
Okay.
and also for in terms of maintaining your certification. For instance, in pediatrics, you have to be certified by the American Board of Pediatrics, and to be able to maintain your certification, there is a lifelong type of learning commitment where you have to complete activities in a span of 5 years or so, or in addition to taking the first time board exam that that determines whether you are board certified, and that's definitely one of the requirements that many employers will have, board eligible / board certified. But there's only so many years after graduation of finishing your residency training that you can stay without certification and being just board eligible. That's not an ideal situation, and I do not believe is even appropriate anymore. In terms of residency training, there's this to maintain certification. The residency programs have to ensure that their graduates will take the board and pass in the first attempt.
Okay, amazing. And so now, as a pediatrician, what does your schedule kind of briefly look like, and what tasks do you spend the majority of your day doing?
Majority of the work for a general pediatrician working in primary care is 8 to 5. Some clinics will work 8 to 5:30 or 8 to 6. You will get lunch. Of course, I do get an hour lunch and half an hour for administrative time to complete reviewing lab results or making phone calls, responding patients' messages. I usually, to be honest, in my case, I usually do not take a lunch break. I keep charting so that I do not have to spend so much time after clinic hours. But yes, so clinic begins at 8, and the last patient's appointment in my schedule 4:45, and then after that, of course, having to complete the work, including documentation, and before, some employers, in my experience, have been by midnight or the same day you close all your charts. Some employers give up to 3 days for you to complete the documentation.
Okay. And so now, are you able to leave all of your work at the office, or do you take some home? I know we kind of touched a little bit on this, but do you see that you do a lot of work at home or after hours?
Sometimes I do. If I did not have time to complete my charting during the day for meetings, or a patient run late, clinic runs late, and depending on whether you would prefer to come home and then chart once my kids, for instance, sometimes it's best for me to just come home right away, and then after I spend time with them, then go back, log in, and do work. And also, of course, if you're on call, then you have to be on the lookout for phone calls, and so that's not every day. I used to take call 1 week every 6 or 7 weeks in average, and then some employers will require that you work Saturdays, Saturday clinic, or after hours.
Okay. And could you expand a little bit on what charting is?
Yes. So in the electronic medical record, when there are several aspects of documentation, you have the chief complaint. Why does the patient come in that day? Then you have what they call the history of present illness, where you will develop or document the child came in because of cough. Cough has been present for so many days. In addition to cough, patient has a decreased activity, decreased appetite, and so forth. This depends on the chief complaint. And then what is important to write down, so that the next person coming in, taking care of for that patient, if it's not yourself, or even if it's yourself, oh, let me remember what happened before I go in to see this patient. Let me see why I saw them a week ago for this, and then also the documentation. Then you put all what you call the pertinent positives, or what things contribute to coming up with a differential and making the diagnosis. Then you have to document the physical exam, and at the end you document your assessment and plan. And then there's more to it, other than just these are the portions that we need to complete. There's so many elements that each portion needs to have in order to justify the level of care. Again, this goes back to reimbursement. And then it depends on the electronic health record. Some of them are more flexible in terms of how you can work with them, and some others are more rigid, and you have to just click, 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 and so forth. And so that's charting.
Hey, thank you for explaining what that is. Do you see that there are any busy seasons as part of this job? And if so, what are they?
Interesting, this question, because it tends to be really busy once school starts. everybody starts to get sick. And so, so that's what we call the fall, winter, and then going into the spring, there's other type of symptoms or things that affect children's life, allergies and bee stings and so forth. But then also you think you'll get a break in the summer. In fact, you may get a little break of illnesses, especially when school is out, because children are not in contact with each other and things don't spread so much. But then it's a busy season for checkups. Parents take advantage, same as you go to the dentist and you get your checkups. So you gotta get your checkups in pediatrics. And adults also, but in pediatrics it's a little more frequent the first 3 years of life, and so they get in their physicals, their yearly physicals, but also sports physicals, and so that there's always something to do, and it gives a little bit of a variety to the everyday work.
Okay. And so we kind of talked about this at the beginning, but could you go into detail, like step by step, of what the career path looks like and what degrees are necessary to get to become a pediatrician?
Certainly. So you have to do your 4 years of college, of course, and taking several of the health science type of courses. Before that, it's important to note that medical school is very competitive, and they will take students that have the highest grades, same as there are competitive colleges and universities. Then it's the same going into medical school. They want to see they're going to want to see a good GPA, and that, and what else other than just studying you've been doing. You have to demonstrate that you have a willingness to serve others. So they will look into volunteer work. They will look into participation in community groups and things like that, and then take the MCAT. Once you take the MCAT, and of course having the highest scores, and then you enter medical school, and the medical school is a 4-year graduate education. It's called graduate medical education. After 4 years of college and 4 years of medical school, then you go into residency, which is 3 years on average, unless you want to do surgery. That's a 5-year residency program. In college, they looked at your GPA or your MCAT results, and in medical school, they look at your USMLE, or United States Medical Licensing Examination boards, in your scores, and then those determine how competitive you are for the best residency programs into any specialty. And then after, when you are in residency, because it's been shown that the higher your scores in the USMLE or medical boards, then the more likely you're going to be to pass your board exams on the first attempt. At least 11 years on minimum.
And then for our listeners, can you explain what you do during your residency?
I miss residency. That was really fun time in my life. Things are different now, and you will hear that a lot. When I was a resident, so in residency, you are learning. You are no longer a medical student. You're a doctor, but you're not a specialty trained doctor yet. I do not believe that you can work just with an MD degree. I feel that there's so much more that you will need to learn in order to provide best quality care. But I imagine there might be some opportunities, but the standard is that you do residency training. When I was in residency, the first year you're an intern, and as an intern, you are the lowest of the totem pole. You get to do the most of the legwork, and it's learning by doing, and also by having mentors. Your second year and third year residents are your upper levels, and they pretty much are walking alongside with you. And I did have great mentors, great upper levels who not only kind of, well, they modeled to me what it would be, what it should be like to be a second year resident and a third year resident. Your level of responsibility increases, and on average, you have certain courses or certain rotations that you have to go through, and including how many. So you go by months. Every 1 month you do, for example, inpatient pediatrics, and another month you do neonatal intensive care unit, pediatric intensive care unit. So you get to experience and to work in all different areas. Nowadays, also residency trainings are gear more towards what would you like to be when you finish a residency. If you're going into primary care, let's make sure you get a good primary care type of experience and tailor your residency training towards what your career goal is after your residency training. So you are given more responsibilities as you go, because also you know more as you go. It was a very interesting and exciting time in my medical career. I do have to note, there's one more thing I wanted to say about being in residency. You get paid to learn. Once you finish medical school, you will have your loans from college and medical school and taking the boards, because that all costs money. But once you're in residency, then you can defer your loans, and then you can you work and you get an annual income. And so it is really neat. You get paid to learn, and then you learn, you get paid, and then you keep on growing and getting ready for your post residency work.
And how is the income different between being a resident and then post residency? Is there a big difference?
Oh, yes, absolutely. It's a big difference. So I'm not sure what the annual income is now for residents in pediatrics. I can only give you my experience, and this was 24 years ago.
Wow.
So the first year resident earned maybe 38,000 a year. Then the second year resident would be I'm not sure, like 40,000, and then 42,000. Then as a fellow, if you do fellowship, then you also get a little higher income. So it would increase depending on the level of training. But for instance, when I finished residency, let's see, I did do fellowship. And at my first job was my fellowship was in academics, and then my first job was a faculty, although I did do primary care and I taught residents and all that. So my starting salary as an assistant professor in 2008 was $123,000. And that was a huge difference compared to my 45,000 a year that I had as a third year fellow.
Yeah. Wow. That is a big difference. After all that education, what are some natural strengths, talents, or characteristics that you think would make someone a good pediatrician?
I feel you have to have that willingness, and you have to enjoy working with children. Otherwise, it's going to be miserable for yourself, for the patient, for the parents, and it's not going to be a good experience. You have to like children. And then also you have to be a people's person. The parents will come in at their most vulnerable time. They don't know. They don't know. And parents, as a parent, I felt very guilty. And I was already a pediatrician, so I can only imagine parents that are not in medicine. So they come in vulnerable, and so it's having that empathy and having that willingness to relate to the parents, and until you can relate to the children. So you have to be able to relate to children in different stages of life.
Yeah. And so now this next question is kind of similar, but it has to do with what topics or subject matters someone would have to be interested in order to enjoy being a pediatrician.
It is difficult to know what, when you're in college for pre-med, you want to just get in medical school. And once you're in medical school, then you have that opportunity to do your clinical rotations. And then you get a feel for what it is to work in different specialties. In my case, I was really motivated and excited about using different color pens and bringing a little toy to distract the child. And originally I thought I wanted to be a OBGYN, but then when I did my rotation and the baby went to the warmer with the pediatrician or the pediatric resident, then I will follow them. So you have to have that passion for little people, for children, and then with the understanding that they don't come by themselves, they have their parents. And so so good qualities would be someone who has that flexibility with in communicating with different ages and developmental stages, and then also with the parents. So yes, a people's person in communication and that's what I would say would be something to inspire you to be a pediatrician once you are in medical school.
Yeah. And so now, what tools or technologies do you use a lot as part of your job? Maybe also softwares or programs, apps, all those things.
In my most recent experience, I of course, either a laptop computer or the PC in your office. I used to have an office in my most recent job that was just general pediatrics, primary care. I had an office with a computer, and then I had my, in terms of software, I worked with web browsers a lot. And yes, I confess I started with Google because a lot of the times that's what parents do. So I want to see what they see. And then in order to be able to say, okay, so I see that this is what the first type of information that comes up. And then now let's compare it to the evidence. And so there's one software program that's called Up to Date. And it is an excellent resource for maintaining current. I know this was an earlier question, but I meant to say that I don't know everything. Sometimes things will come up that I say, well, I'm not sure about this, and one has to be able to say that. So I do not know, but let's look it up together. And I do that a lot with parents in the office, and then we look it up, and I show them the evidence and said, okay, so I find that this is some of the things that can be tried, and this is some of the studies that should be taken into consideration, and so I use Up to Date a lot. And so in terms of software, is that the electronic health record software, I use Epic, and that's really, of all the electronic health records that I have worked with, Epic is by far the best in my experience. But also I use my cell phone. I have apps in my cell phone that, for instance, I have one that like a pharmacy kind of type of app where I can look up quickly the medications with the doses and side effects to discuss with parents. So I use that a lot. And also you have your other apps from when you're on call and they page you, or the secure messages, and accessing the minimum of their records, so you can get an idea of what the patient, the background, and when you call, you return a phone call about a parent's question about their child. One great addition lately to my work was a microphone. They call it Dragon. It's a system that when you dictate, it just transfer it to the electronic health record. It's beautiful. And there's even one that you have in a cell phone that is called Ambience, and so it's also from Dragon. And then you are talking with the patient, and then the application is getting what you're saying and transcribing it in the medical record, even if you do not have software open up in the computer. And so when you go, it's already there. You just edit. So there's a lot of things that are being developed in order to take the burden of administrative type of work from the physician, so they can do what they do best.
Yeah, that's super cool. I didn't know about that one. And so now we want to give our listeners a little bit of advice. So what do you recommend that candidates that are interested in this job do in order to set themselves apart from other?
If you're applying to a pediatrician's job, then you will be competing with other pediatricians. They will probably most likely look at your, I guess, experience, not only with before residency training, and that enter your volunteer type work, and what, or even during residency, there's so many opportunities to get involved in community service. Some pediatricians do mission trips, medical mission trips, or you can also go to schools. When I was in residency, that was one of the things that we could do. We could go to schools, and we could, in my case, my passion was share book reading, when reading books with children. And you can start doing that at 6 months old. And anyway, so going to schools and giving and just already demonstrating that you are interested in having that relationship with children, more than just being academically sound and have a lot of demonstrated knowledge, but also that experience. So that would definitely set a candidate apart from other candidates for a pediatrician type job. And also, as in many other special careers, having a second language. Spanish is big in Texas, and I believe it's becoming the second most spoken language in the United States. So if you speak Spanish, that is a must. I'm sorry, that is a plus that will set you apart from other candidates. And of course, prior experience if you are coming into a job from another job in pediatrics, because it will happen. You can get into a job and you find it's not a good fit, or you're going to change jobs because you're moving to a different state, a different city, a different part in the city. So you apply to other opportunities, and then they will look to see, okay, so what was your experience before, and then I believe they will also look into reviews. Now patient satisfaction is out there, and that's that customer satisfaction or patient satisfaction is a very it's a very important factor when one is being evaluated in terms of how you perform.
Okay. And so now, just kind of out of curiosity, is it true that there's kind of like in your residency, there's obviously other residents there, but is it true that there's some sort of competition between the residents, and how do you become a standout resident?
It's difficult to say because I'm 20 years out of my residency, but when I was a resident, my year, we were very, very close together. It's almost like a special bond that you share with a group of people that are going through the same struggles of being a mentor. That's perhaps the most difficult experience until you become a parent, a first-time parent. But it is such a meaningful time in your life that you bond with with your fellow interns, and so you go along and you work together, and so that is, I believe that counts when they see that you are not just out for yourself and to just do just yourself, but just being a good team player, that you are there to support others, that you are a good role model to your junior residents, and so forth.
And so now, what are some books, resources, or programs that you recommend our listeners check out if they're interested in pediatrics?
I cannot think of a book or a resource other than experience. I feel experience is the most important resource before you go into residency, when you are in medical school, and not only for your for what it is your required training or your required rotations as a medical student, but perhaps volunteering in a school or in a children's hospital. Maybe that's something that students would do more before getting into medical school. But maybe working or shadowing residents in pediatrics, and you will get that opportunity during medical school, but perhaps in addition to what is required. I do have some, not necessarily medical students, but maybe earlier in their the basic sciences type of the first couple years of medical school, although that also was changing at the time that I left academics. So having opportunities to shadow, and even as pre-med student, shadow a person in their in the actual specialty. So I have had students approach me, or even in first year medical school, though it it's becoming a little more difficult with HIPAA. There's the health, the privacy, and so forth, and so that it can be tricky, especially at Baylor. I know that to be able to shadow, you have to go through a process, and they only have some affiliations with different certain number of universities, and it's not something that you wake up and say, oh, I know somebody who's a pediatrician. I'm just gonna go and see if I can shadow him during his day of work. So it has some, there is a system for it.
Yeah. And so now finally, if you could talk to your younger self when you were just starting out or maybe just starting med school, what would you tell her?
You're going to really love pediatrics. So make sure that you do your best in your pre-clinical rotations, in your basic type of clerkship. Maybe I wouldn't say anything different to myself. It would be because I wouldn't change anything. And if I had to do it again, I feel I would do it again. If I'm my younger self again, I would do it just the same. I'm glad that this question, you're asking me this question, because it really reassures me that yes, you have to have a passion from the beginning, and then you have to get your feet wet and see all these specialties, and then say, okay, what really resonates with me, with which one I can relate the most. And again, it's not that you're out there by yourself. You always have some models, some role models, some mentors, and even as a medical student. But I guess I would say that you really are going to love pediatrics. So have fun during your clerkship. Do not get so upset about stuff that you think is not going to be relevant. It will be, and then in your rotations, it's going to be okay, because this is what you're going to love and this is what you're going to do.
That's amazing. Thank you so much for sharing that. So, well, Rosina, that's all that we have for today. Thank you so much for coming on and talking about your experience. Your insight was greatly appreciated. Thank you so much.
Thank you, and you're most welcome. And I really enjoyed being part of this today.
You just got one episode closer to learning about the world of jobs out there. To explore the rest of our career categories and find your best fit, go to jobdictionary.com to sign up for the beta users waitlist. Then subscribe here to find the next episodes coming out this week. And as always, drop us a comment, review, or message to let us know how we can better attune our episodes to your specific needs. Follow us on TikTok, Instagram, Facebook, LinkedIn, X, Threads, Pinterest, and wherever else you're on socials to go get our short, snappy preview reels that expose you to new job options every day. Because here at Job Dictionary, we believe your big aha moment can be just one scroll away. Go check it out and get out there. Cheers!